Thank you so much for having me here today. As Robin said, my name is Megan Irwin. I'm the Acting Early Learning System Director, and I'm really excited to be here to get to talk to you for a little while this morning. I'm also deeply humbled to be here to talk with you this morning. I feel so lucky that I've been given the privilege of doing this role and doing this work here in Oregon with all of you. And I couldn't agree with the theme of this conference more. We are better together. The only way that we're going to build the early learning system that we dream of in this state for all of the children in our state is by doing that work together. So what a perfect theme for the conference. I've been in my role as acting director for just about 2 months now. And when I stepped into the role, the Early Learning Division, the Early Learning Council, and I decided that it was really important to take some time to reflect on where we're at in the system building work that the state has taken on over the course of the last 4 years. And so we have been really reflecting on what we've accomplished together so far. And when I say together, I truly mean together with every single person in this room and all of the people out in the communities that you represent. And what we've accomplished together so far is significant. And we've also been reflecting on what we have yet to accomplish, which is also significant. And so I wanted to use my time with you this morning to share some of the reflections that we've collected on the system and just kind of look at where we've been, where we are now, where we think we're going over the course of the next couple of years together. And I have to say it's been a really exciting few years for those of us who work in and care about early childhood education and family supports. Nationally, early childhood education is enjoying a much deserved moment in the sun. It definitely did not hurt to have the president put early childhood education front and center in his 2013 State of the Union. And campaigns like Too Small to Fail have put our work front and center for many Americans. In addition to significant investments that the federal government has made in state-level early learning system building. I think you all know they've done that work through the Race to the Top Early Learning Challenge grant, which Oregon was lucky to win a few years ago. The federal government has also made a significant investment in home visiting and family supports through the Maternal, Infant, and Early Childhood Home Visiting Grant, which Oregon has also received. And may not relate directly to the work that you do day to day, but I think that the investment simultaneously in home visiting and childcare from the federal government has actually been really important to us being able to think about what it means to support families, to support their children to be ready for school. Early childhood is also having an incredibly important moment here in Oregon. Our governor supports early childhood education tremendously. The Speaker of the House does as well. So the political stars are sort of aligned for our field in a way that they rarely are. And 4 years ago, the state set out on a mission to reshape its early learning system. And we set out on that mission around some core principles that we don't always talk about or put front and center, but in the reflection that I've been doing with our staff, these principles around how we do our work together have become more and more important. In my opinion, how you do your work is as important as what you're actually doing. And so the principles that have emerged around how we are doing this system building work are these. The first one that stands out really clearly is the need for strong cross-sector coordination. We're really working to build a true system across sectors like health, human services, early childhood education, and we know even within early childhood education, you can parse that out, the K-12 system and the private sector. And the reason that we're doing that, using what we call a collective impact approach, is because it's just so clear that there's no one program, there's no one sector, there's no one leader or strategy that can single-handedly accomplish the goals that we have for children in our state. It really does take us all bringing the collective wisdom and resources that we have to the table and working together in ways that maybe we haven't before if we're going to accomplish the goals that we want to accomplish for kids and families in our state. So the first principle of how we do our work is collaborating across sectors. The second that's become very clear is a strong commitment to local decision making. We operate at the Early Learning Division under the belief that local leaders and providers know the needs of children and families in their communities in a way that is much deeper than we in the state Early Learning Division could ever understand, and that local leaders are in the best position to make decisions about how to use the early learning investments in our state. So the second principle is local decision making. The third is extremely important and a place where I personally feel we have a long way to go as a state, although I'm glad that it's a core principle of our work. And that's a deep commitment to equity. The belief that if we're going to really build the system that we want to build, we have to focus on and talk about deep inequities that have existed for populations in our state for a long time and get really serious about doing something to address it. So the third principle of how we do our work is a strong focus on equity. And then the fourth is shared outcomes. So coupled with that belief that it takes us all working together to get our goals accomplished, we also believe that to truly have a cohesive early learning system at the state level and locally on the ground, we need to have collective responsibility for the work across the board. So we have a collective responsibility for doing the work together, and we have a collective responsibility for the results. And the outcomes that we believe that we're collectively responsible for across the system, and we are just as accountable to these at the state level as we're asking local communities to be, are, you've probably heard these a million times, you could probably almost recite them with me, I bet. But number one, ensuring that children arrive at kindergarten prepared for school, that families are stable and have the supports that they need to really do the development and support for their children that helps them arrive at school prepared to be there. And then the third goal or outcome that we're all collectively responsible for is that system coordination piece. So those are the principles that we are using to try to guide our work together and the outcomes that we're responsible for. And at this point, I just want to pause and acknowledge that every single person in this room has been called to work with us toward those principles and toward those goals in their communities. Some of you are doing it through your work with Child Care Resource and Referral. Some of you are doing that work and you're working with or leading an early learning hub in your community. That's a tremendous amount of effort and commitment. And I, throughout my talk, will say thank you over and over again. We are so grateful that leaders like you have been willing to go all in with us on this and see what happens. So thank you so much for your partnership in that way. I also want to acknowledge that since 2011, there's been a tremendous amount of change put on our system around the three outcomes that I just mentioned. And so I thought I would just point out a couple of the kind of key highlights and pieces of work that we've done as it relates to those three outcomes. And by the time I'm done, you'll realize if you're feeling tired, there's a reason. We've been working really hard. So first one, kindergarten readiness, kids being ready for school. When it comes to kindergarten readiness, I think the most significant movement that we've been able to make really does come from the $35 million that we got from the federal government for the Race to the Top Early Learning Challenge. I want to acknowledge someone sitting in the back of the room, Dawn Woods, who, if it wasn't for her, we would never have gotten that grant. She just spent the last 2 months of her life writing another one that if we're successful will bring $15 million a year to Oregon for 4 years to expand preschool. And so, Dawn, we couldn't do our work without you. And she never takes any credit for herself, so I just had probably embarrassed the heck out of her. But anyway, the Race to the Top Early Learning Challenge grant that we got allowed us to do a couple of really important things. I think you all probably know the big one, and we'll get to that in a second. But one thing that it let us do is partner with the health authority and the health sector to actually operationalize the use of a statewide developmental screening tool. Which is really important. Our focus on developmental screening is allowing us to understand the needs of children at younger and younger ages and find out if they have a developmental delay or a potential disability. We're able to intervene earlier and help them be more prepared for school. So that developmental screening piece although it gets talked a lot as a family stability support and a part of the healthcare system, I actually view it as an important part of our school readiness strategy. The other thing that this grant allowed us to do, which is I think one of our most significant school readiness strategies, is it allowed us to develop and start to implement the quality rating improvement system, which you all know is allowing us to move beyond the division's previous work of simply regulating the health and safety of childcare environments. And we're actually starting to be able to give childcare providers the support and the professional development that they want and need to turn their programs into high quality learning and child development environments. And I know that you all are deeply in the weeds of that. That's the work that you do every day. And I just want to take a moment to have you all just stop and think and really acknowledge how significant that work that you're doing with providers is. Since most of the children in our state are in childcare, we want those environments to be rich learning environments before they reach school. And the work that you're doing every day, helping us implement the quality rating improvement system and providing support to childcare providers, is a huge part of our state's overall plan around school readiness. So thank you for that. Since you're so in the weeds all of the time, I wanted to just call out some things that I think are really exciting highlights around the quality rating improvement system. First, I want to acknowledge that where we're at right now is pretty significant, considering we're about 6 months into the statewide rollout of the system, and we have just over 28,000 children in QRIS participating programs. That's a big deal and really fast pace. And so again, you all must be tired. You've been working really hard. The quality rating improvement system is important for all children who are in childcare. It's important for all childcare providers. In my opinion, it's even more important for vulnerable populations of children and families who often and historically have not had access to high quality programs, such as children whose families are receiving subsidy or children with disabilities. It's critical that those children and families have the ability to choose a high quality setting, and that children with special needs and children who have been traditionally marginalized in our system have access to quality. And so today, or at least as of September 30th, we had just over 2,000 children who were on subsidy in a QRIS program, and 45% of those children are children of color. So a small number. Of course, we all want that number to be bigger, but still just worth acknowledging that we're making progress in that way. And then additionally, we have about 1,300 children who are on IFSPs who are in star-rated programs, which I think is also really important. So the numbers are small, but again, 6 months ago, only 48 children on subsidy were in QRIS programs, and only 13 children on individual family service programs were. So in 6 months, that's exponential growth. And I can only believe that with how committed you all are to this program, that that's going to continue. As we're continuing to roll out the QRIS, we are also focusing on ways to make sure that we continue to reach populations of providers through the QRIS program who reflect the demographics of children under 5 in our state. And that as we're building this new system for improving the quality of licensed care, we're not accidentally creating barriers to access. And so that's something that our team is thinking a lot about. And as practitioners on the ground, if you have insight into that, we would love to hear that from you as we think about the next stage of our rollout here. So those are a couple of the things that I'm the most proud of around our implementation of work toward the goal of kindergarten readiness. When it comes to family stability, it's also been a busy couple of years for the work that we do here at the state. As I mentioned, our colleagues in the Public Health Division have been able to secure 2 rounds of the maternal, infant, and early childhood home visiting funding. And that's allowed our state to expand access to home visiting programs, which evidence tells us help prevent child abuse and neglect and dramatically increase family stability for families that can access them. And through this grant, we've been able to expand access to those programs in some of our most at-risk counties across the state, which I think is significant. And then also on the home visiting front, the Early Learning Division received an additional investment in the home visiting program that we run directly, which is Healthy Families Oregon, that's allowed us to serve more families and we're now allowed to serve subsequent births. So you all, as early childhood development professionals, know that sometimes the second baby is even harder than the first one. And previously, through this program, we were not able to provide home visiting supports to mom when she had her second baby. Now we're able to. It's kind of a big deal on the policy side. And we were also able to invest new dollars into our state's system of relief nurseries, which provide therapeutic preschool and respite services for families experiencing a significant number of risk factors for child abuse and neglect. I think 16 risk factors or more. Those are the families who are served by relief nurseries, and so I'm really proud that we've been able to invest in that system. And then this isn't a state investment, but I always think it's worth mentioning that the private and the philanthropic sector have also gotten really engaged in family support and stability through the Oregon Parenting Education Collaborative. And that's exciting to watch that grow and expand and bring into focus the importance of parenting education, which I bet in your work you've seen throughout the years. As I've been reflecting on our shared work across health and human services and early learning as it relates to family stability and supports, I do think that this is an area where over the course of the next 4 years, I want to see us spend a little bit more time kind of focusing on. I would like to see our state have a more robust agenda for infants and toddlers, and I'd like to see us have even more specific kinds of supports that we're able to offer to families beyond home visiting and relief nurseries, which are really our two strategies right now. So that's an area where we're deeply interested in thoughts around what a family support infant toddler policy agenda could look like. And if you have thoughts on that, I would love to hear them. Our third goal that we've made a tremendous amount of progress on is system coordination. And when I really step back and look at the last 4 years, a lot of the work that has been done has been focused on aligning and coordinating the system and kind of trying to create the conditions in our system in which we can be more successful around kindergarten readiness and family stability. So this is where a lot of work has happened. In 2013, the state established the Early Learning Division for the first time. So that was one big chunk of the system coordination work that we've done. We've been charged with bringing together the state level early learning and family support programs under one division. So there's kind of a single point of accountability for them. It's the first time that the state has had an early learning division, and we were placed inside the Department of Education, which I think is a really interesting place for us to be because it acknowledges that the work that we do and the work that happens in childcare settings is not daycare. It's not, kids are not just being watched, they're being educated by the people who you support. And so I think that the creation of the division and placing us inside the Department of Education actually sent a really important message around what it is we're doing here. The Early Learning Council was also established to govern and guide the entire system, which really spans 3 state agencies, us inside the Department of Education, but also the council oversees our coordination and connection with the Health Authority and the Department of Human Services. So they play sort of an important connector role. Also, in the last several years, we've established common early learning standards for children from birth to 3 and children from age 3 to kindergarten. We were able to restore past funding cuts to the Oregon Pre-Kindergarten Program, to the Healthy Families Program, to the relief nurseries. And last but not least, we established a strong state to local partnership model for building the early learning system through the early learning hubs. Folks in this room I know are deeply involved with the hubs in their communities, so I won't spend too much time there. But for folks that haven't been as involved, just as a reminder, the early learning hubs are basically locally based and governed coordinators for early learning services. So the state has set out some outcomes that we'd like to see our local early learning systems achieve with us. We've made some investment. I hope we can make a bigger investment in the next biennium in the hubs. And then given communities the flexibility and freedom to tell us what strategies they want to use to get to those outcomes. And so that's really the big sort of putting the pieces of the system work in place that we've done. It's a lot. I think everyone in this room can be proud of the work that you've been doing at the division. We are certainly proud of the work that we've been doing since we came together a year ago. And it's not enough yet. This state was recently ranked the poorest on the West Coast. So it's not enough. In a state where racial and income-based opportunity gaps persist, and those opportunity gaps turn into achievement gaps by the time we get to third grade, not enough. So much of what we're doing right now is in the early stages of implementation. It's fragile, and we are going to need a disciplined focus, along with the willingness to be reflective and flexible and adjust our strategies when things aren't working right, in order to reach our goals for kids in our state, in order to reach our goal where children are arriving at school with the foundational skills they need to be prepared to become lifelong learners, to reach our goal of families having the stability and supports that they need to create those conditions for those children. So then the question is always, what's next? I wish this was a month from now, because then I could talk freely about what I think is going to be next from the governor's budget and the legislative perspective, but we're just not quite there yet, so stay tuned. So on the policy front, here's what I think is next. At the division and across the system, we are deeply focused on how to actually operationalize our beliefs about equity. We have adopted an Oregon equity lens across the education system. It's great, and we have a lot of work to do to show that we're really serious about implementing that equity lens, and a lot of work to do to learn what that actually really means. And so that is something that's front and center for all of us at the division, and front and center in all of the policy work that we're doing now and that we will be doing going forward. We're also focusing on how to ensure stronger connections across sectors. We're looking at the lessons that we've learned from the first couple of years of this work, and trying to see where we have areas for more growth in terms of how we're connecting health to early learning, human services to early learning. Gotten a lot of feedback from the field about places where in local communities you kind of get right up to a point of collaboration and then you get a little stuck. We've heard that feedback. We're really focusing on what are the actual policy, financial, and administrative barriers in the way. That's a big part of what you'll see from us in the next year, is we're really working to sort of systematically remove those. We're also at the division focusing on how to make sure that our baseline regulatory work that we do, licensing childcare and monitoring it, and our baseline program work that we do, starts to become more integrated and married to the strategic initiatives that we've been given to implement, like the quality rating improvement system. For this work to be sustainable, the baseline work that we've always done and the new work that we've been given to do have to start to find more ways that they actually connect and become the same thing. And so we're really working on figuring that out at the state level as well. What you will always hear from me is that we're going to keep evolving and keep learning, and that we want to do that together. So many of you in this room have been called on to do a lot, and you have done everything that the state has asked you to do. Thank you. And I think over the course of the next biennium, as we continue to learn what works and what doesn't with the quality rating improvement system, as we continue to learn what works and what doesn't around system coordination, we're just going to all have to stay in a place of mental flexibility and willingness to adjust based on the information that we're getting about what works and what doesn't. But we will be doing that together as partners. And it's my personal mission, and I believe it's the mission of staff at the Early Learning Division as well, that when changes have to happen, we're making those changes with our partners across the state and not imposing them upon you. So that's some of what you can expect from us next at the division. And then also, I would say we're working really hard to figure out how to get the message about early learning out to the public. We spend a lot of time preaching to the choir, and I want us to get really evangelical about why early childhood matters, why early brain development matters, and get it out to the unusual suspects, the people who are not always involved in our work, but should be. I think that's how we sustain it. The final thing that I'll say to you is that we're listening, and we know we don't get everything right 100% of the time, because that would be impossible. Nobody does. But we really are a learning organization, and we welcome feedback about what we're getting right and where we're missing the mark. The final thought that I'll leave you with is that the state government, my division, the division that I run with staff, can't improve early childhood education by itself. It's just not possible. We certainly have a tremendous responsibility to work with partners to improve the quality of early childhood education and improve access to it, but we can't do it alone if we ever think that we're going to reach our goals. We have to do this work together. The barriers for children in Oregon are tremendous. The barriers for families in Oregon are tremendous. We can't overcome them with one strategy or one agency or one leader tasked with improvement. It really is going to take everybody. And so as we move to the next stage of our implementation work, the things that I just articulated very briefly, I'm personally thanking all of you for working with us so closely as partners on the ground, for hanging in there with us when things have gotten bumpy. From all of the staff at the Early Learning Division, we are so grateful for everything that the people in this room have done in recent years and throughout your entire careers to provide support for children and families and childcare providers. And we look forward to continuing this work together. And I'm calling upon you to continue to do this work with us together, because I just know we're really smart, but we can't do it by ourselves. So thank you all for everything that you've done, and I hope you have a wonderful conference. Thanks a lot.